All right. Someone around you, hopefully it's not you, but someone around you, I pretty much guarantee your neighbor, your cousin, your nephew, your nephew's coworker, your cousin's neighbor, your neighbor's cousin, someone in your orbit is probably frustrated right now, worrying about whether they're getting everything they can out there. A lot of people out there struggling, worrying that they're getting everything they can from Social Security, retirement benefits, disability benefits, Medicare, Medicaid, all the rest of it. So this is kind of going to be a complete insider's guide to all of that. I'm going to go through the entire list. I'm not going to be able to go through every single detail. So that's why we're doing a live Q&A like we do every time this time of the day. So if you're new, make sure you subscribe. I'll talk about an overview of all the programs. People think Social Security is just Social Security cards and retirement. And they're our community here. By the way, if you're new, welcome to the most compassionate, the best community on social media. Every single day, we find people that are frustrated or confused about the entire bureaucracy, and we help them navigate the bureaucracy. And we find people money every single day. So a lot of people out there are living a little bit better, a little bit easier for month to month because they were able to find benefits because people subscribed and liked and shared and all that kind of good stuff. And they were able to find our channel and get those extra benefits, and that extra helped. Most of this is what you paid for. So all those decades you paid your taxes, all those decades you paid into FICA, Social Security, Medicare, and all the rest of it. Let's make sure you're getting, and everybody around you is getting what they are eligible for and what they need, okay? And to make this a little bit easier, to follow, not necessarily you, unfortunately, but I've got a bunch of acronyms there, and I'm going to go through this entire list. These are just some of the programs that are available out there for those people. We got millions of people about to lose their health insurance. Millions of people out there are struggling from month to month. And so let's make sure that they're getting everything they can. So I'm going to go through this relatively quickly. I'm just going to give a broad overview of all the different programs out there. Quick little talk about eligibility. Each one of these, there's over 20,000 pages of Social Security policy. If you're new to my channel, I ran the third bus Social Security office in the country. I've taken millions of claims, helped millions of people out with all of these. So there's over 20,000 pages of policies. There's exceptions to the exceptions to the exceptions. And we're not going to get into all that because this would take weeks and weeks and weeks to go through it. So, retirement benefits. Pretty much everybody's good on the retirement benefits, but they often file incorrectly. There's early retirement. You can start your benefits as early as 62 years old. There's one you can start at 60. We'll talk about that one. So, early retirement at 62. If you start your early retirement at 62, it's obviously reduced. Anytime you take money from Social Security early, whether it's retirement benefits, survivor benefits, spouse benefits, survivor benefits, your benefits are reduced if you take them early. That's different from disability benefits. We'll get into that one. If you take them at your full retirement age, also called the FRA, full retirement age, and then you get your full benefit amount. If you wait till after your full retirement age, you actually get more. It's called delayed retirement credits. So delayed retirement credits are 8%. So if your full retirement age is 67. So if you were born 1960 and after, your full retirement age is 67. If you wait until 70, you get an extra 8% per year, 24% extra. So if your full benefit amount, let's say it's $1,000 at your full retirement age, once you hit 70, you're going to get $1,240. So, and then obviously COLA increases and all the rest of it. One of the big reasons why people decide when to take their benefits is these next two things, the annual earnings test and the monthly earnings test. So there's limits to how much you can make if you file for benefits early from Social Security. So if you're under your full retirement age, you have to stay under that. For next year, for 2026, that's $24,480. Any money you make after that, Social Security holds back $1 for every $2 you go over. And this is different. A month you could Social Security can also switch to what's called a monthly earnings test, a monthly earnings limit. The first year when you first start filing for benefits, Social Security doesn't care what you made before, they go to the monthly, and that's for next year's $240. And I've got a bunch of videos on that. If you want me to go into more detail on that, I'll definitely do it. If your benefits are suspended, they can be readjusted at your full retirement age. It's called the adjusted reduction factor. A lot of people don't understand that one, and they wonder why their benefits are increased or whether they will be increased. So, you not only get a COLA increase if your benefits were suspended, then your retirement benefits were suspended, you also get that ARF. A lot of people missed that one. I'm moving Medicare up here a little bit. I wanted to talk about disability next, but because we're in one of the many enrollment periods, let's talk about Medicare first. So we've got Medicare Part A, Part B, Part C, Part D. You got Medigap plans, which are FG. There's 10 of them, but the most popular are FG and N. You've got the special enrollment period, the initial enrollment period, the annual enrollment period, the general enrollment period, the I missed one, the open enrollment period. You got Medicaid, you got dual, you got LIS, MSP, okay? Hey, if you need help with Medicare, Medicare Advantage, Medicare supplements, Part D plans, make sure you reach out to my partners at Chapter Medicare. I looked for a place that would help y'all out, and Chapter Medicare knocked it out of the park. They've got excellent customer service. They look at every single plan in your area, and their help is always 100% free. Give them a call, and they'll see if they can help you out. And tell them Dr. Ed said hi. All right, let's go give an overview of, again, if you want me to answer specific questions on these, please ask them in our chat or join us later in another live. Okay, Medicare Part A covers your hospitalization. That's what you pay in your FICA all those decades. So that's why Medicare Part A for most people, 99 whatever % of people don't have to pay a premium for Part A, is 0 premium per month, and that covers your hospitals. Part B covers essentially your doctor's kind of outpatient type stuff. Your doctors, if they go to the hospital to do surgery on you, that's what it's covered. So that's your medical type stuff. That is for 2026. The monthly premium will be $22.90 over a $17 increase over 2025. And then you've got Part C, which I don't call it Part C, but Part C are those Medicare Advantage plans. By calling it Part C, it sounds like it's part of the original Medicare, but it's not really. You're giving up original Medicare to get privatized Medicare through a Medicare Advantage plan, and over 50% of people choose a Medicare Advantage plan. Usually it's a budget issue. They just can't afford a METAG GAP plan. So those METAG GAP plans, they do have a monthly premium. So if it's an F, a G, and N, these are all standardized. A Plan G in Florida is the same as a Plan G in Texas, which is the same as a Plan G in California. They're all the same. The only difference is price. And if you get original Part A and Part B of Medicare, awesome, great. But Part B, there's a 20% co-insurance. So if you get a $100,000 Band-Aid from your doctor, you have to pay 20%, $20,000 of that out of pocket. So that's why people get either a Medicare Advantage plan or a Medicare supplement plan. And nobody can tell you which one is best for you until they talk to you, ask you a bunch of questions, see what your budget is, your doctors, and all the rest of it. Right now, we are in the annual enrollment period up until December 7th. So, if you need help with a Medicare Advantage plan, reach out to our partners at Chapter. Just make sure you get the one that's best for you. How do you know? You be prepared. You have your current plan if you have one. So you can compare what's your current plan next year is with what else is out there with your current company or a different company. You have your providers, the providers you definitely want to see in 2026. You have your prescriptions, the milligrams, all that. If you have a particular pharmacy you want to use, you have the name of the pharmacy. You have priorities. Do you need more dental? Do you need more vision? Do you need more hearing? Whatever the case may be. And then prices. Are you going to be getting a bunch of MRIs next year? Or you might go to hospital and you want to find out how much it is to stay at a hospital overnight, or whatever. And then one of the most important things about Medicare Advantage plan is you need to stay persistent. Prior authorizations, networks, you have to keep those guys your Medicare Advantage plan on. You have to battle those sometimes. And that's what Chapter does. They have a member success team that helps you battle those prior authorizations and all the rest of it. So if you need any help, they're free. Nobody should charge you for helping you find a Medicare plan. They don't charge you. They look at all the plans in your particular area, ask you a bunch of questions, part of those 7 Ps right there, and then find the best plan for you, and your new plan will begin January 1st. I've got a video question that somebody sent in. I'll play a little bit later that they didn't understand that the new plan started January 1st, but I'll show that later. All right. So Plan C is Medicare. Part C is those Medicare Advantage plans. Part D are the prescription drug plans. Most Medicare Advantage plans already have the Part D bundled in there. If you get a Medigap plan, an F, a G, an N, or whatever the case may be, you have to get a Part D standalone plan. If you don't, there's penalties. Just as if you don't sign up for Medicare when you're supposed to and you don't have creditable coverage, then you're going to get penalties for the rest of your life. So, and if you want me to talk about those, well, that's a whole different 3 different videos. Anyway, so you've got your initial enrollment you've got your SEP, your special enrollment period if you move or something like that. You've got your initial enrollment period when you originally turn 65, or you originally start your disability after 24 months. You got the annual enrollment period, which we're in now. You got a general enrollment period. If you don't sign up, then you can sign up in for A and B in January, February, March. You'll get penalty probably if you sign up in general enrollment period. And then there's all kinds of other different enrollment periods. Enrollment period, when you can actually sign up and change your plan, is probably one of the most confusing things about Medicare. It's crazy. So you can reach out to Chapter and they can see if now's the time for you to do it or when is the best time for you to do it. Medicaid is different than Medicare. Medicaid is a state federal program. It just got cut about $1 trillion from the federal government. So everybody that's on Medicaid is going to have a tough time going forward. Even if you're eligible, they're going to be nickel and diming you, trying to kick you off, reducing this or reducing that. If you had dental this year, might not next year or the year after. Medicaid is in bad shape going forward. You can't cut $1 trillion out of the budget and expect it not to hurt everybody, and it's going to. So it's unfortunate. So you sign up through Medicaid through your particular state, and some states, a lot of states call it different. You got Access is in C, Arizona. That's Medicaid Medical in California. That's Medicaid Alaska, I think they call it, with Denali Care. Each state's a lot of states call it different things, but it's all basically Medicaid, and it's for low income, low resources. And then a lot of people don't realize you can get both. You can have Medicare and Medicaid, and then you'll get what's called the Medicare Savings Program, MSP. And that is basically where the state pays for if you're eligible, the state pays for your Part B premium. So if someone you know, your neighbors or coworkers, your cousins are having a hard time paying that $185, $22.90 for 2026, then tell them apply for Medicaid and hopefully the state will pay for that $22.90 and some other cost sharing as well. And there's also called the LIS, the Low Income Subsidy. That's also called the Extra Help with Your Medicare Prescription Drugs. A lot of people save money on that one. You apply for that one through the Social Security Administration. I've taken hundreds of thousands of those. Those are one of the easiest applications you can take at Social Security. So, all right, let's get into disability. So, again, if you have any questions, if you need help with all things Medicare plans, make sure you reach out to Chapter Full Disclosure. They support this channel. They support all the free websites that we have and all the rest of it. So, we appreciate them. Disability. So there's several different types of disability. You can get SSDI. That's based on what you actually paid into Social Security, SSDI, Social Security Disability Insurance. And then there's another program that people often confuse. They think SSI means Social Security Income. It doesn't. It means Supplemental Security Income. It is a welfare-based program the Social Security administers. Social Security offices are made up in 3 units, and 2 of those units, one of those are Title II, which I was before I became a manager. Title II, they do retirement benefits, survivor benefits, SSDI, Medicare. And then you've got SSI, Title 16 of the Social Security Act. They do SSI, welfare. And you can get SSI, supplemental security income, either based on being disabled or aged, 65 and older. And the max you can get from SSI from Social Security for 2026 is $994. Some states also give you a state supplement, but from Social Security, the max you can get is $994. Either be an SSI aged or SSI disabled. SSDI, it depends on how much you actually paid into Social Security. All right, and then we've got DAC benefits. Those are disabled adult child benefits. So, if you have a child that became disabled before the age of 22, I know I'm going fast, so I'm going to start going a little bit faster. Just kind of get through these. You can slow me down. There's a little thing on YouTube where you can slow the person down, or my wife mutes me all the time, I think, in her head. But anyway, that's a whole different issue. But if you hear any, oh, your ears perk up and you're like, oh, that might apply to this, then again, ask your questions. So a disabled adult child, that is, if you have a child that became disabled before the age of 22, they can get benefits on a parent's record if that parent is receiving retirement benefits, disability benefits, or deceased. So that's called disabled adult child benefits. And then you've got child disability benefits. A child can get benefits, SSI benefits usually for being disabled. And then you've got disabled widows benefits. That is, you can get disability not on your own work record, but on a deceased spouse's work record. Disabled widower hour benefits. And you get those between the ages of 50 and 59, okay? And then probably one of the most difficult things are working while receiving disability benefits. And you can work and receive disability benefits. Actually, Congress and everybody wants you to work. Try to go back to work to see if you're able to work. And if you make more money, then you get off disability. Helps you out, helps us, helps the trust fund out. You pay more taxes, which I guess everybody loves. So there's all kinds of work incentives to get you to go back to work if you're able. If you're not, then, it is what it is. But I've got a website, mygovexpert.com, and you just click on the disability there and working and benefits, and it gives you, I've got a worksheet there that it tells you all about. I'm updating this for 2026, and it talks about all of the details of working and collecting disability benefits. You are able to work. They're called the trial work period, the extended period of eligibility, substantial gainful activity, and all the rest of it. Unsuccessful work attempt. It just goes on and on and on and on. Okay. And we also have, if you're receiving disability benefits, you might get reviewed. One of those reviews is Work CDR. So if they find out you're working, Social Security finds out you're working, they will give you a continuing disability review based on your work to see if you're staying under the SGA and trial work period and EP and all the rest of it. There's also regularly scheduled medical CDRs, continuing disability reviews. So when you're approved for disability benefits, they usually give you a timeline that says, hey, every year, every 3 years, every 5 years, 7 years, or never, whatever the case may be, we are going to review your disability to see if you got better, or you've got a surgery that improved, whatever, or you got new medication, or they're just going to review it every now and then. And if you're denied, if your benefits are canceled because of a work CDR, for instance, you can what's called an EXR, expedited reinstatement. So if you have the same disability and your disability benefit stopped because of work, and it's within 5 years, you can file an expedited reinstatement. Not sure why they call it expedited reinstatement because there's nothing expedited now at Social Security. Elon Musk and Doge in the current administration cut thousands and thousands of people that were there to help you navigate the bureaucracy, and Congress doesn't want to provide customer service. They've been trying to, make customer service as terrible as they possibly can at Social Security. So You will hate Social Security or blame the employees, but it's the politicians that give Social Security resources because they want to privatize Social Security. But anyway, let's get into spouse benefits. So spouse benefits are a form of retirement, but it's a retirement. You have to file for benefits on your own record. There's an exception. What I say about exceptions, the exception. So you file for benefits on your own record. And if you're entitled to benefits from a spouse or a divorced spouse or a deceased spouse, then you can file for those benefits. Surviving spouse benefits, that gets a little complicated. You don't necessarily have to file for benefits on your own record first. You can choose one or the other, so I'll talk about that if there's anybody there that wants to parse that out. And then there's a thing called independently entitled divorced spouse benefits, IEDS, where if you were married to someone and you had to be married for divorce, you had to be married to that person for 10 years. There is a common law thing. So if it depends if your particular state recognizes common law, that Social Security recognizes common law, because the state Social Security has to go by what the state determines. State does marriage and divorce. So if the state says common law applies, then common law applies, and Social Security has to abide by that. But 10 years and independently entitled divorce spouse. So many people out there missing benefits on spouse benefits. Incredible. We just found someone a few days ago that got an extra $2,000 a month. They should have gotten it starting 2021, but they didn't know about it. And they watched our video because somebody subscribed or shared it to them or pressed liked, and the algorithm got it to this person, and the person said, well, that's me. Wait a second. And they called up and they got an extra $2,000 a month. So many people out there like that. So please do all that, SC, subscribe, and all that. Anyway, so independently entitled divorce spouse benefits. If you have to file for benefits on your own record. And then if your ex is eligible for benefits, not necessarily receiving benefits, but they're eligible, that means they're at least 62 years old, or they're receiving disability benefits, then you can file even if they haven't filed themselves. A lot of people miss that. You had to be married 10 years. And this is the only one where this one applies. You have to be divorced for 2 years. So the final divorce has to be 2 years, only on independently untitled divorced spouse. Let's not mix those up. A lot of people mix that up and lose benefits. And then there's what's called the child and care benefits. If you're a spouse of someone receiving retirement benefits or disabled benefits or are deceased, you can receive child and care benefits. That means you're taking care of a child under the age of 16. Or someone that became disabled before the age of 22. So that's more benefits for that person. There's work requirements, obviously. But anyway. And then there's the lump sum death pen benefit, which is lump sum death payment, which is the most embarrassing things at Social Security. It's $255. It's been $255 for decades and decades and decades. So if you lose someone, you can get, possibly survivor benefits, but you can also get that one-time lump sum of the $255. Yeah. Anyway, there's one that almost nobody knows about, parents' benefits. So if you were dependent on a child, adult child, and that person passed away, parents can receive benefits off that person's record. But they have to prove, that they were dependent on that person's income. Grandparents, yes, grandparents can receive benefits or their grandkids, but they have to adopt that grandchild or the child's parents have to be disabled or deceased. So if there's a lot of grandparents out there taking care of grandchildren and they want to know, well, I'm receiving retirement benefits. Can my child under the age of 18 receive benefits on my record? Yes, if those qualifications are met. And then we've got obviously SNAP benefits, which is another one that is going to really, really be hurt going forward, is food stamps. Before I worked for Social Security, I worked for the Department of Social Services doing Medicaid and food stamps and all the rest of it. So I answer questions about that. People have overpayments out there that they're dealing with. You can fight an overpayment if Social Security makes a mistake. If you get overpaid, whatever the case may be. Again, on my website, mygovexpert.com. I've got on, you click on more, click on overpayments, and it gives you all the different ways you can, pay the whole thing off, request a lower withholding, and Doge changed all that. Then they changed it again, and then they changed it back. So yeah, Doge just didn't know what they were doing from day one. So there's that. But someone says, I heard they're broken up. Yes, they're broken up, but all the people that were in Doge have gone out to the different agencies. So there's a bunch of Doge people, the Commissioner of Social Security, which the Commissioner of Social Security, his part-time job is Social Security, which has never happened since 1935, that you have a Commissioner of Social Security that does that moonlights as a Social Security Commissioner. He's also the CEO of the IRS, which is a brand new made-up title. So it's crazy. Okay. So appeals, fight. That's what a lot of people miss. If you got to fight, if you're denied retirement benefits, disability benefits, SSI, Medicare, Medicaid, your Medicare Advantage plan gives you a prior authorization that you disagree with, your doctor disagree with, fight, 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 appeal, 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 always, always, always. And then a lot of people are living overseas, and there's a bunch of qualifications for people living overseas, and I've got that. I've got my website, and it talks about an entire section on living overseas.